I'm Salimah Handa, Executive Director of Informatics at Piedmont Healthcare.
I'm Dr. Robert Budman, the Chief Medical Information Officer for Piedmont Healthcare.
One of the main drivers for us bringing Nordic in was an attempt to meet the needs of our Piedmont Clinic. So they're a clinically integrated network of physicians across primary care as well as specialties. And one of their challenges is providing enough metrics so that we meet our regulatory requirements around an ACO. And so a challenge for us is meeting our measures from a regulatory standpoint as well as providing enough metrics for that group. So that group had several measures that they wanted built out that our group wasn't necessarily able to support with our current resources. And so we looked to bring Nordic in to assist us with that build as well as optimize some of the other metrics that we had from a eCQM and PQRS claims-based build perspective, and they were able to help us come in and achieve that.
Before we took on the Nordic consultancy to establish this, we hadn't really had well-defined working parameters for what we wanted to accomplish. Nordic really helped us focus on what the actual work product and end result had to be.
We had a couple deep dive meetings with all of our team as well as their team present, and we're really able to get into the details of what we needed done pretty quickly. They were then able to go away, work pretty independently on the measures, and come back just periodically to check in with us and pretty much just validate they were on the right track, which they pretty much were the entire time. And then we ended up really accomplishing everything we had set out to do in a pretty fast timeline of 7 to 8 weeks.
When we kicked off the project with Nordic, I was very impressed with the executive and management engagement as well as the expertise of the folks they brought to partner with us. And in the long run, as we had regular meetings, it was really great to see the progress and get the feedback from the combined teams.
Our Nordic project was a success for 3 reasons. One, we are now able to provide these metrics to the Piedmont Clinic so that they are able to offer them to any new providers that we may bring on board, whether they are primary care or specialty. We are able to meet our requirements from a regulatory perspective because we now support claims-based and eCQM build, as well as being able to use the framework that they provided when we are optimizing our metrics going forward.
I think the end result that we built was more satisfying to the end user, which enhanced productivity, but also very importantly was the efficiency of gathering the data out of those metrics and being able to present them in a usable format.
We had a great experience with Nordic, really because I felt like we could be very open about what we were trying to accomplish. We already have projects in the works that we are definitely keeping Nordic in mind for as soon as we get to the point where we're going to use some outside help.
Clearly, we had a good working relationship with Nordic, and we look forward to working at that level of professionalism again.